Hey, is Rachel walking? Because she's like talking on this note? I don't know if she knows that. Can I see department? Should I get that would be sure? I don't know if she knows that yet. Picked you up. Oh, I know my name. It's really big and Frank. There we go. Oh, we have the papers.
Did you need me to bring anything this time?
There we go. All right. Well, no, it's working.
Oh, wait.
That's okay.
Yeah. Oh.
All right, well, we're gonna go ahead and get the meeting started. It is 12:01. Thank you all for joining us this afternoon for the Franklin County Prevention Coalition Health Council meeting. We're so glad y'all chose to join us and show up here today for some pizza. Thank you, Sophia, for the pizza. And I hope everyone has been able to consume some of those warm chocolate chip cookies out there. I cut all those little slices for you all in the shape of pizza. So you know, just pretend like, you know, it's just another piece of pizza, but it's warm and chewy and all gooey. But my name is Tabitha Curtis, and I am the former coalition director here for Franklin County. I currently serve as the Franklin County Prevention Coalition Board Chairman. So with that being said, let's go around the room and everyone introduce themselves, because I see a lot of new faces this month. I'm excited to have y'all all here. So I'm going to do it backwards. So we're going to start with you, Melanie.
I'm Melanie Morrow, and I work for the Franklin County Prevention Coalition.
I'm Emily Haynes, and I'm a youth ambassador for the Franklin County Prevention Coalition.
I'm Jaden Manza, and I'm also a youth ambassador for the Franklin County Prevention Coalition.
I am Mindy Lefishore, and I'm with the Human Place Abortion Recovery Ministry.
I'm Meredith Pugh, and I'm one of the newest regional overdose prevention specialists here.
Rick Payne, Franklin County resident.
Justin Owens, I'm community engagement specialist for SOCAP.
I'm Justin Ritchie, I'm a regional customer specialist.
I'm Lisa Ross, I'm with Pharmacy. I'm Jessica Radke from Partners for Healing. And I'm Emily Martin, also from Partners for Healing. And Cassie Fuller with the Franklin County Chamber of Commerce. Kelly Riley, Franklin County Industrial Development.
Doug May, Ryan King Center, Gap Ryan.
I'm Tobias Spangler, and I'm the health link coordinator with North America.
I'm Heather Lee, and I'm a health link coordinator with Health Connect America. I'm Megan Ackland, and I work with DHS in Puerto Rico. I'm Nancy Kilgore, and I'm also Health Connect America.
I'm Angie Fuller, County Commissioner, and also with Kiwanis.
I'm Haley Colvin, Franklin County Health Department Director. Kelly Ware, Healthy Development Coordinator from the Southeast Region.
Beth Delaney, Health Promotion Director, Southeast Region.
Cindy Smith, I work for the Chem Corps.
Mac Warren, a volunteer with the 12th District Drug Court.
Sophia Leon Meza, Public Health Educator for Franklin and Grundy County.
Hi, friends. That's just so many friends here. It's so great. But I'm Jessie Sheehan. I'm the director of the Franklin County Prevention Coalition.
And I'm like. Okay, can we start with Paula?
She just joined on her.
Okay, Rachel, can you introduce yourself, please?
Yes, can you hear me? Yeah. Okay. Hi, I'm Rachel Swafford. I'm with the Tennessee Department of Health in the Southeast region, and I'm the Regional Substance Misuse Response Coordinator. Apologies for not being there in person today. I'm trying to multitask.
Okay, glad you're on with us. Katie Kelly?
Hey, I'm Katie. I am with Centerstone Mobile Crisis. I'm the clinical supervisor for the mobile crisis team that serves Franklin County.
Okay, Lindsay Bass?
I'm Lindsay. I am with Children's Hospital at Erlanger. I'm the Pediatric Trauma Injury Prevention and Outreach Coordinator, and I'm also over Safe Kids Southeast Tennessee.
Mandy Easterly?
Hey, I'm Mandy Easterly with A Step Ahead Chattanooga. I'm a health educator for Bledsoe, Sequatchie, Marion, Grundy, and Franklin counties.
Okay. Let's see, Jay Bowling, I think you finally got connected. We saw you were trying to connect. Okay. And Paula? Okay, either Pat or Bowling.
$6,000 funeral expense. Insurance. We still owe $4,000.
It's expensive, I know.
Okay, well, welcome to everyone again here in the meeting and that's joining us via the Zoom. We appreciate your attendance again. So in front of you, you have the minutes from the last meeting, which was May 16th, 2022. If you haven't had time to take a look at those minutes, we ask that you do that at this time. And then we would also ask that we get a motion to approve those minutes and a second.
I make a motion to approve the minutes.
I'll second. Okay. All right, well, thank you. At this time, we're going to ask Sophia, are you going to give the county health assessment update?
Making notes. Okay, Melanie, if you can hold that. PDF. All right, so we have finally closed our survey that we've been working on for the last couple of months. For those of you who haven't heard, we have been working on the community health assessment to see what are the top 3 things that we need to work on or things that we need to change in our community. So that survey, we put it out in the newspapers, we put it out at Health Connect. I mean, we've tried to put it everywhere we could so that we could get our community's input on what are the things that we need to work on.
How many did we get?
We got a total final number as of this morning was 532 surveys.
All right, guys, do you know how hard it is to get 500 surveys for people? So good job, everybody.
Well, a special thanks to everybody that helped us to either get us a booth at your event or put the surveys out at your business or organization. We really, really thank you for your support. All right, so here are the final survey results.
For some reason, it won't let me share to everyone online, so.
Oh, okay.
I was
Okay, that second slide. All right. That's it, okay, sorry. So, like I said, there was 532 surveys completed. That was a big number compared to 1 month. I think last month we were at 300, right around 300. So we ended up with 532 total, 1 listening session, and then two key informant interviews completed. Here's the age. The minimum age was 12, the maximum was 91, and the median was 49 of everybody that took the survey. When it came to what is your gender, 81.4% was females, 18.1% was males, and then 0.4% preferred not to answer. And then this is the question about the education. So I have the numbers in front of me. Okay. So less than high school diploma, it was 3.4%. High school diploma, it was 29.6%. If they had vocational training, it was 10% of the people that took the survey. Associate's degree, it was 13.6%. Bachelor's degree, it was 23.7%. And then graduate degree or higher, it was 19%. And then 0.8% preferred not to answer. And Beth, I can give you this after, so you don't have to type all that stuff in 1 minute. Okay, we'll go to the next one. Okay, when it comes to the question where it says, what is your race or ethnicity? 1.3% was American Indian. 0.8% was Asian or Pacific Islander. Black or African American was 5.3%. Hispanic or Latino was 2.3%. And white, it was 90, this one, it was a 90%. And then the other category was this one. Okay, there was a question on there about your household income. Less than 25,000 was this one, the 18.9. 25,000 to 50,000 was 26.9%. 50 to 75 was 18%. 75 to less than 100,000 was 15.5%. And then 100 or more was 17.4%. And then we have 3.2 that preferred not to answer that question. Okay.
Can I say something about the demographics real quick? So I think that we have a lesson to be learned here on how we're doing these surveys. If you remember a couple months ago, we talked about how we had to really target some populations we're not getting because our demographics for this survey are not inclusive to the population that we have in Franklin County. If we take this demographic and we take the mean demographic, we don't have the mean person in Franklin County. So we did a really good job. We doubled the numbers on some of those areas we didn't have. But when we go to do a community survey, we really have to work harder. Because if you look around this table, this is the people that we have working on these surveys, okay? You look at those demographics, it makes sense to us. But if you look at the census survey and who lives in Franklin County, we are missing people that just are not having a voice in this. So I think we did a really good job of trying to target that, but I think that we have more work to do in that area.
For sure. Okay, so this is the chart. Do you guys remember on that survey, there was those vital signs on there and they had to list on there whether they thought it was a minor problem, major problem, or not a problem at all. So this is, to me, I think it's one of the most important charts that we can have because it's telling us what our community thinks are the major issues in Franklin County. So youth obesity, 13% of people that took the survey thought it was not a problem. 44.2% thought it's a minor problem in our community, and 42.8% thought think it's a major problem. Physical activity, 14.3%, they don't think it's a problem. 38.9% they think it's a minor problem, and then 46.8% think it's a major problem in our community. Youth nicotine use, 13% said it's not a problem. 30.8% said it's a minor problem, and 56.2% of the ones that took the survey think it's a major problem. Drug overdose, this was a biggie too. 11.8% think it's not a problem in our community. 18.6% think it's a minor problem. 69.5% of the people that took the survey think it's a major problem in our community, and I think we know that it is a major problem. Infant mortality, 43.7% don't think it's a problem. 42.5% think it's a minor problem, and 13.8% think it's a major problem. Teen births, 19.8% don't think it's a problem in our community. 51.6% they think it's a minor problem, and 28.5% think it's a major problem. Community water fluoridation. 47% they don't think it's a problem. 40.6% think it's a minor problem. And then 12.5% think it's a major problem.
Can you save your voice? Tell me to save your voice.
Do you want? It's okay. I mean,
I know, but you said you have to make it.
Yeah,
all
we're here.
Okay, so
the next one.
will this be available? Can we share this?
Yes, and I can share this with you guys. I just wanted to let you know because I don't have the percentages on here.
Got it.
That's why I'm telling you the exact numbers.
Okay. You guys want us to read through all those numbers? So which one?
The major one.
The major ones. Okay, and I have that right here.
Got it.
All right, so the major, I did like my top 3 and then I had to go back and add 2 more because I think some of these relate to each other. So,
Right.
the number 1 that our community think it's a major problem is drug overdose. 370 people put on their survey that they think it's a major problem. Second comes in adult obesity at 354. And then third, it's adult smoking. Okay, so right then and there, we know that substance abuse and obesity. So third one was adult smoking. So smoking, I think we can relate it with substance abuse. We can encompass that. The fourth one, they have youth nicotine use, which I think we can also, work towards that under substance abuse. And then our fifth one was cancer, but right underneath cancer came frequent mental distress at almost 300 people. And also, there was another one.
So we're looking at the gray lines.
Yes, the gray lines, yeah, which is these, both obesity, drug overdose, and, what was my third? Adult smoking. Adult smoking. So I think for looking at all of this, what do you guys think if, because we have to pick 3 issues or 3 things that we want to focus in our community. We already know drug overdose, which we can just generalize it and say substance abuse in general and include tobacco, alcohol, drugs. And that can be adult and youth as well. And then I feel like physical activity was another that was big. So I think we can combine obesity and physical activity into one category. And then the third one, there's several things we could do. But what do you guys think? Do you guys like the combining of those? Obesity and physical activity and then substance abuse?
Substance abuse, would that include the adult and youth smoking?
Yes. Definitely included in there.
I mean, I know you said that the mental distress is the gray area.
So the numbers on that, the mental distress is 52.3 people think that it's a major problem, 34.4 think it's a minor problem, and only 13% think it's not a problem.
So that makes it about roughly 80% of people consider it a problem.
And it can be an underlying problem for some of these
And
other
that's the thing,
issues.
so to me, it's a link problem. So if you really lump a big 3 per se, you could do substance use and abuse, obesity, and mental health, because they're all interrelated in some fashion. But you could do adult and youth in all aspects of that, and do a big 3 of those.
What do you guys think? You guys okay with that? Anybody has any other comments to make? Because this is what we will be focused in the next 3 years.
Because when you look at mental health, you could also lump in suicide under that.
Yeah.
Which ties into the drug overdose problem. So it really encompasses all of a lot of the major target areas that
Well-
all of your groups individually are working on. And it comes together and works.
If you only target one of those things, then you're not really fixing the problem. You know, we know that there's a correlation between mental health and substance use. We know that there's a correlation between obesity and diabetes and physical activity, which also leads to mental health. So if we don't look at it as a whole, we're not going to get to the root problems in the community and be able to start solving them.
Okay. So we will do that. Jesse, I'm gonna get with you before our next meeting and we can start. We are already doing some things to target these areas. But if you guys have any best practices or things that, something different that you want to see in your community, let us know because we can definitely make things work as long as it aligns with our, what we're doing.
And you think about the coalition, a group of people maintaining their own identities, working towards a common goal, right? In this room, we have mental health services, and so we have Health Connect, and we have Centerstone on this call. So when I have questions about what we're doing with mental health, that's who we turn to. So, you know, you guys really need to help us lead the way. And what are the best practices that we can start turning these, where's our turning point? Is it that we need intervention or is it that we need prevention? What are the best practices? Because that's not my wheelhouse. So, but it's yours. And so that's how we can partner together and really get that. And then we start working to, you know, just as a unit. I'm excited for this.
Yeah. Okay, and I can send this out so y'all can see it, and I can also send out the charts with the specific numbers as well. All right, let's see. I think we kind of talked about our next slide as well. Okay, there was another category where people were able to type in whatever, like if it wasn't listed on the vital signs, and these were just some of the things. Not a lot changed from our last meeting. Mental distress was very, a lot of people said mental distress in the other category. And then they said lack of activities in the community, but if you follow the Chamber's page, you'll get all the events that are going on in Winchester. So maybe promoting that a little bit more within our community will help. Addiction, drug use, I mean, a lot of these are the same from our last meeting. Okay, we'll go to the next one. And then our plan, we kind of talked about it. So I'm going to work with Jesse on a plan and then bring it next time so that you guys can prove it or if we want to change things. And that way we are all on the same page. Okay. Thank you, everybody that took the survey. We really, really appreciate your help. If you help us distribute the survey, I also thank you. Thank you. We could have not gotten those numbers without your help. I think we are one of the other 3 counties in my region that are doing this. They have not gotten to 500, so I feel very special. Awesome. They were also struggling with. So,
what's our next steps?
Just the plan. Just work on the plan and then finalize it.
Okay, so is the next meeting
I say we
more of a work group meeting?
We can do it however you want to.
I also have Title VI training that I have to do as a coalition. So does anyone need that for their work, that you need to have special Title VI training?
If you work for the state, you talk.
Yeah, but they might do it internally. But I'll need time next month to do the Title VI training, and then we can just make it a work group and work on the plan.
Sure.
So I need all of you back again, from organizations to civic leaders to citizens. Like, you don't understand how just important everyone's opinion is when we go to create the plan. Nothing about us without us, and you're the us. So I need you to help us create these plans so that we can start making some impacts.
Again, thank you all for your support in completing the surveys or distributing them. I think it did a really good assessment of our community and what we really need to be targeting. definitely in the area that we all know that's so near and close to home for so many people, and that's the drug overdose that we're experiencing right now. Program updates, the coalition update. Jesse, are you giving that?
Yep, so the coalition continues to grow. Matt Brown took a position in another county doing very similar things. It's a grant project that we work very closely with. He is now a care coordinator. And so we got Meredith. She's our new bro. Do you want to give us just a real brief introduction to you?
My name is Meredith Pugh. I'm primarily from Murfreesboro, Tennessee, but I now live in Manchester. I was working in the substance abuse field for a little over 3 years. And I was just looking to expand my knowledge and growth in the community. And I heard about Jesse's opening. And so now I'm the newest regional overdose prevention specialist working with Dustin. I'm in training, so I'm still learning everything. But
Less than 2 weeks, just started.
Like super fresh. So, I'm super grateful to be here, and hopefully I'll get to know some of you guys along the way.
And then we also have youth ambassadors. Youth ambassador is a position that we created a couple of years ago where we, again, nothing about us without us, right? But I need to have some youth input. So that youth ambassador helps me with that gap, that 18 to 24 age, where we don't have a lot of interaction with. So the youth ambassador position is a summer position, typically college students, and they help us have that, just kind of keep that youth mentality going, help us know how to reach people. They work on things that we use all year long when it comes to campaigns and ideas, and make sure that, you know, we are still appealing to our group. They're a lot closer to high school students than I am, because it's been, you know, more than a few years for me. So they are super important. We've had great success over the last couple of years. So this year I have 2, and super excited because these 2 are youth that we have poured into, and now they are coming to us to pour into others. So that's always a huge success story. So if Emily, you'd introduce yourself, tell us a little bit about you. Take a deep breath.
I'm Emily. I'm home from the summer. I'm actually doing it's called J3. It's a discipleship school in Scottsboro. So I'm here for the summer. And before doing the summer and going to school, I actually was kind of here quite a lot, helping over at the bridge and stuff like that. Very involved with the rain and the camp and stuff like that. So
just like you're just home for the summer doing what you do. Okay. And then this stranger here.
I'm Jaden Van Zandt. Please bear with me. My voice is gone. I just came back from TTI. But I recently graduated from Middle Tennessee State University with a degree in psychology. I also was very involved with the RAIN and Camp RAIN, and like I just said, TTI, which I did since I was 13. So this was my 9th year at TTI. And I got involved in that through being in the Youth Coalition when I was very young. So I've been around the coalition for pretty much my entire life.
Tell them what TTI is.
TTI is the Tennessee Teen Institute. It is a youth leadership camp. We're there for a week, and we talk about drug prevention, we talk about alcohol, we talk about safe driving. We talk about healthy relationships and social media, and pretty much anything that like a young leader would need to know about, we cover.
Awesome, thank you.
I just have to say, I have known Jaden Van Zandt since his birth. Literally from the time he came into this world. But I've had the honor and pleasure of working with Jaden from the time he went to TTI the first time. I just felt really old, Jaden, when you said how long you've been doing TTI. But it has been an absolute pleasure working along with Jaden, and now getting to see him, like you said, give back to the full.
Right.
And I thought somebody was giving you a shout out, Jaden. And being able to give back to his community in a respectful way. And congratulations on your recent graduation. Okay, Health Council GAKAC update.
Yes. So remember last meeting I had asked you guys about changing the name, blah, blah, blah. So anyway, I sent out an email and got pretty much everybody's vote in. And so the back to school bash will now be give a kid a chance. Okay, because we're giving them a chance to be successful in their education and whatever they want to do that comes along with that. So it's give a kid a chance. This is our first year with the name, but we've been doing back to school bash since Tanya was here, I think, if not more than that. So here is our a long time. Yes, yes, yes. So I've got the flyers for the event. It will be on Wednesday, July the 20th at the Franklin County Health Department. It will be drive-through. We're doing that once again this year just because we don't know how the numbers will be in a month. So starting at 8:30. So I've got flyers. I'll pass these around, and if y'all want to take one for your local, for your business or anything, we can do that. If y'all can just post it there. Now, if you want to set up a table, if you want to come and set up a table, I've got the forms. Thank you. I've got those forms also. These are the same forms we sent out with the letters asking for school supplies. So if you want to come, just fill one of these out for me so I know who's coming and if you'll, if you'll need anything, electricity or, which, we'll be outside. So I have this. Also, if you know of somebody that will really help us, we're still collecting money for backpacks. This is a form that they will also need to fill out for donations and registrations.
Is there a deadline for vendor sign up?
Yes, if we could have, if you're planning on helping, if I could have those forms back by, I would say the week before, so that way it'll give me time to prep, the 13th of July. You can eat, or when is our next meeting, the 18th? The 18th. Why don't we do the 18th? Okay. On that form, you can fax it to me, you can email it, or if you want to drop it off at the health department, that's also something you can do. Or if you want me to come pick it up, that's also something I can do. Should we do the 15th then, that Friday before? Okay, July 15th for, if you want to register for back to school, give a kid a chance. And then I also wanted to let you guys know a little bit of how we're doing. So we have, so far we have $300 that came in for backpacks for, that's monetary donations. I'm still counting backpacks from last year because we had some left over. I want to say we have at least 300. I feel pretty confident with that because we had to, when we finished the event, some of the bags ripped. And so we had to put them in other bags. I had them separated by gender and grade. And so it was kind of a mess with the bags ripping. So I'm having to sort them out again, and then I'm still counting them. So I think we are around 300 backpacks in stock right now. We're still needing pencils, crayons, glue. I've requested scissors for the younger grades from the hospital. They're still working on that. We're going to look into take it to their meeting and see if they can do that for us. But scissors, I'll just put that tentatively on there. We have 146 glue sticks. We have about 100 erasers. We have 193 color pencils. Folders, we don't have any. Binders, we don't have any. Did you say you wanted to do folders? We got folders. Okay, so Prevention Coalition's doing folders. And we are prepping for, what did we say, I think it was. Okay. We're prepping for 650 kids. Pencil pouches are welcome, rulers are welcome. We don't have any of those. I think that's mainly our urgent needs right now. But if you guys have any questions, just come talk to me after the meeting, or call me, or email me, whatever is easier for you. What else? We will be setting up the day, not setting up, but pre-packing the backpacks the day before at the health department. Did we say 1 o'clock afternoon? In the afternoon, we're gonna pack the 19th of July at the health department. If you guys would like to come help, we would love to have you. If you want to bring your brochures, bring them. We can go ahead and put them in the backpacks as well. Because this is not only a school supply drive, I also take it as a resource for the parents that come. Because you'll have at least 250 parents that come with those kids, so.
So will your tables be drive-by tables? Or
Mhm.
are they gonna-
Kind of like we did last year, where we had the stuff set out and then they just drove up to the table and just gave it to them. We'll need cones. I'm gonna contact the Winchester Police Department. Because we need cones
At
and
the
then,
sheriff's department, because you're right there at the sheriff's department.
yeah, one of the two. And then I want them to be there to also help us just direct traffic in case the one. So in the morning, I think it can get a little bit crazy because they're lining up early. But as it goes pretty quick, so I'm not too worried once it starts going. Okay, so traffic control. We don't want no accidents. Okay, that's all I have about the Give a Kid a Chance.
Okay. Josie, can you share about community scans?
So let's back up for a second because I'm about to get on my soapbox.
Should we talk about the town hall meeting
Yes.
first? Okay.
So we
Before you go on
have,
soapbox.
right, so we have a town hall Thursday, it's Thursday, oh my gosh, called Fed Up with Fentanyl. I don't know about you, but I'm getting really tired of losing people to overdose, and fentanyl is hitting us hard. So on Thursday, we have a town hall where we're going to discuss the issue. We're going to take a look at what's going on in Franklin County. We're going to take a look at what's going on around the state. We're going to talk about the impact that it's had on people, and then we're going to talk about what we can do about it. We're having it at the high school at 6 o'clock. And at 5:30, we have some great barbecue that was donated for us. Fellowship a little bit with each other, network, and let's get to solving some of these issues. Because it's real and it's sad and it's happening right here. So while we're talking about what's going on with all of this stuff, I said, well, let's take a look at our community. And so we did another community scan. We do this about once a year, where we go out and we take a look at what does Franklin County look like? What are we seeing? Because honestly, we have created an environment that is conducive to drug use, and we don't even know it. We don't even see what's on the shelves anymore. And we're allowing things in, and it's changing the culture, and our kids are getting caught up into this culture because it's just part of their environment. Okay, so that's why I get on my soapbox so bad. So I got to stand up and move. Get scared.
I'm gonna do that too.
Okay, so I sent some of our guys out to take a look at what we can find in stores. So we know that marijuana is not legal in Tennessee. It is not legal for medical reasons. It is not legal for recreation. We do know that it is legal in several states. So seeing things like edibles is common in these other states. So we start seeing it in pop culture. We see it in TV, movies. We see it in our music. Okay, so that's how it begins with our culture, right? So like, well, yeah, but it's not in Franklin County. This is Warhead candy that my kids love. Now, how many here have, let's be honest, okay, we have a pretty good age dynamic. Who's ever been like, oh man, I could really use a Warhead right now? Anybody? Okay, that's cool.
Younger.
Right. Okay. But who really likes that stuff? It's like the younger you get, the more they want it, right? So even in states that edibles are legal, what age are they legal at? 21.
So why does it look like something my kid's gonna find in his Halloween bag? Right? Because this here is the exact same logo as that. Okay? Now, it does say medicated, which also gives that, implies that this is good for you, right? When you talk about younger people and what they're saying, medicine's good for you. It does say THC 0 or THCO, but this sticker comes off and that rips off when you open it. So as a parent, if I'm not looking, how easy would it be for me to just overlook that? I walk into a store, I'm like, oh, there's more of that candy stuff my kids like. Do I look at it? No, it's not on my radar. It even says on the package, this package contains cannabis, a Schedule I controlled substance. Why is that being sold? How is that being sold? There are loopholes in the law. At what point are we going to say enough is enough? What's the difference here? There's a one-letter difference. If you're not looking at it, if you're not looking for it, you're on the phone going up to one of these gas stations, okay? You're on the phone, you're talking, because we multitask, right? So I can see me doing this, sending a text message, my phone's ringing, this thing doesn't stop, here's what's going on, they pay for my gas. And my 7-year-old going, Mommy, can I have this? Half the time I'm like, will you be quiet if I give it to you? Yes. And if I don't look at it, there it is. Now I will tell you that they cost, what, $15 for a little packet? That might get my attention if I pay attention before I swipe my card. Chances are good if I'm distracted, I'll get home, not even know it. Not even know it. And they know this. This is what kills me. This is what kills me. This says the same thing. Contains a Schedule I controlled substance. Keep out of reach of children and animals. Can only be processed or consumed by persons 21 years of age or older. So why are you targeting the kids? That's what I come back to each and every time. They know that it looks just like that. That's on purpose. There's no accidents when it comes to their design here. Starbuds, Cannaverse. At least it's different, right? But if you just look at it, like I saw this over and over again. Starburst. No, that's Starbuds, Jesse. Same warning on the back, adults 21 plus. I like gummies. I like the sweet, like the fruit flavors. I can't remember the last time I was like, ooh, I really need some though. And then other ones, this is Flying Monkey, Sour Tropical Blends. Now they're not copied off anything else, but they still look like kids' candy. Go ahead. This is Delta Vape. We are starting to see this more and more in our middle and high school. I will tell you that these particular brands were on the high end. Okay, what were they? One was 55. I think that was the next one. This one I think was 30. So if you want, you got to pay for it. But again, that just makes them want it, and that's what they begin to seek. Go ahead. Was this the one that was 50? I think it was black. But I mean, it's even using words like indica. We learned a few years ago going to a conference that you have indica nights and sativa days. Or is that the other way around? Indica day. One's an up, one brings you up and one brings you down, and I forget the verbiage.
Indica's a downer.
Okay, so that's a marijuana term.
That's not necessarily, it's not like CBD terms. That's not hemp terms, that's marijuana terms. You go to a dispensary in Colorado and you're looking for a strain, you're looking for if you want an upper or a downer. And that's marijuana. So they're using that same language and bringing it to the end and calling it Delta 8, saying that it's okay. And this is right here on the front counter. You walk in the door, hopefully they're in a case. Most of the time they are because they're expensive. So they want to try to, keep you shoplifting. But as soon as you walk in, here's your vape displays, here's your Delta displays, you've got Kratom over here, and look, right past that's your candy aisle. Right? I don't even let my kids go home with me to stores anymore. This is the one that was 55. Eat cake. What's this right here? And this is what they're trying to get. Go ahead. So here's some displays. Here's buds. What's the difference between that and marijuana and a traffic stop? They can't tell anymore because these things are coming in. We are seriously tying law enforcement's hands to do anything because what's the difference? This one's legal, that one's not because somebody said so. Kratom, that's been around. That came in to the market, what, 2.5 years ago? My kids, let me talk about my kiddos for a second. My little Elijah is going into the 2nd grade and he's learned to read. And he's so excited to learn to read. And he reads everything. So we're driving down the road and he's saying, that says drive-through. That's, we signed it up pharmacy, but then he's like, what's Kratom, Mom? Do you know how many signs, how many of those big flags we see driving down the boulevard that say Kratom? And then, I stop at, we go to get a haircut at Great Cliffs. And the only parking spot I pulled into was right in front of this new shop. I haven't even been in that one, so I can't say anything good or bad about them, other than they're selling this stuff. And it's bright and shiny and all this colorful stuff. And he thinks it's a toy shop. He wants to go in there. But Mom, they got that Kratom stuff. Yeah, let's talk about this. My little kid who's in 2nd grade. This is the environment that we now have here. We are creating an environment conducive to drug use. We are making this part of our local culture. Go ahead. So first, let me premise this with, I took some pictures when I was at High in the Hog. I am not saying anything bad about that festival. I think it's needed. We need to have things for our kids to do. I love the Kiwanis. I think this is a great event. They didn't see this. Right? This is my perception that I'm going to bring to you so you see how I view the world and some of the things that we let slip by because we don't even notice it. So don't take this as a negative towards that festival or Kiwanis at all. All right? But this here, let me set the stage. So you walk, we're walking down the carnival, and here is skee ball right here. Okay? Which would be like right here, right next to that table. You walk over here and here's this table. And they have all this stuff on the table. They've got the clothing things. And then they've got, you come on in. They have right in front, you can't see it in my picture. It sits like right here. There's a table that has those little dogs and cats that walk and meow and bark, really annoying little things. Okay. So the kiddos are coming over. And so they're right here looking at the dogs and cats. And then they're looking at this cartoon hat that's right here and here. And here's pipes. Those are bombs. Right there on the table. I'm not okay with that. I'm not okay with that. I'm not prepared for my 5-year-old to come up to me like, Mommy, can I have one? No. Like that's not okay. There's a place in the space if we have to sell that stuff, but at a festival with carnival rides is not the space for that. Go ahead.
So then there's the signage, which again, my little Elijah is learning to read, and some of this stuff, you know, he's asking me, and there's a planned word that he doesn't understand. But guilty pleasures, okay? Lemonade slushies, fried Oreos. Okay, I get that. But this looks like that candy I just showed you. That's not even for sale there. Do you see the drug reference in here that's right in front of us that we don't even recognize? Go ahead.
So that looks like a cup.
It is, go back.
A cup of gummies.
Yeah, it's like a slushie, which I see that, they sell slushies. But then it's got all of this candy stuff that
So that's how they're getting away with it, because it says slushies there and
they're trying to have a lot of play on words to be funny. You know, it's for that young adult group, because it's part of that culture and they want to bring them in. I get why they do that. I just don't want it here. I don't want that for my kiddos. I don't want it for your kids. And here, the sign didn't make sense to me because they're not selling that kind of candy. Okay. So, totally fried. We get that reference, right?
For the slushies you mentioned earlier, do they fit those school things?
I didn't see them sold that way.
They weren't sold.
I didn't see them that way. I saw the big machine, they used to like this, and here's your slushie.
I just wondered if that was.
Once you combine all of these signs she's fixing to show you, it makes a little more sense.
So totally, this is the one that my little Elijah was like, totally fried? I don't understand. I said, well, they fry that stuff. And he goes, you fry hot dogs? Nachos? I was like, well, they do there. I mean, like, how do we explain that to him, right? But again, it's a drug reference. And I understand the marketing. I do. I just don't agree with it. Because there's ways that we can do that appropriately. Right? So this one is hard to see. It was hard to take a picture because of where it was at. But it says, we sell addicting white powder. And
What?
that's what it says. And he's holding a funnel cake with powdered sugar, and I agree, that's totally addictive white powder. I get it. But the dude that's holding it's the cocaine cake, like from the 80s, is this okay? Now, do our kids necessarily understand that reference? Probably not. But is it around inside that culture? And what are we bringing to that? These are things that are in our space. This is happening in stores all over Franklin County. And again, I'm not picking on the carnival, but it was a really good way for me to show what we're allowing without even seeing it. We can't sell pipes and bongs on the same table as we do whistles and cartoon hats. Like, that's not okay. If we're going to have this type of thing in our community, if we're going to have THC gummies, if we're going to have the Delta 8, if we're going to have the Kratom stuff, why does it have to be in a store that our kids go into? Why do we have to involve them in that culture? If it's going to be sold, can we define how it's sold? That's just my thoughts. I think that's the end. Questions, thoughts, comments, booze, tomatoes, anything?
Well, I have a comment, because this has been a battle we've been fighting for, how long was Angie? Many years, and we've talked about it and how basically what's been happening with our community. Now, and this is not just Franklin County, it's all across the state of Tennessee. But what's happening is it's just basically social grooming our culture and especially our children. So when all these things that, you know, it just becomes the norm for them that they see these things. Back to the time, you know, I can remember going out with the vape shops and the convenience stores asking them about the bongs, and they're saying, oh, it's for tobacco use only. You know, that was, you know, this has been 10, 12 years ago, going out doing that kind of work. And, you know, the store owner saying it was for tobacco use only, when we knew good and well in Franklin County, most people aren't smoking tobacco through a water bomb. I've never seen it done. But with that being said, it's a major issue, and it's going to take coalitions all across the state of Tennessee standing up and saying enough is enough. And that great clip, I remember pulling in that parking lot over there and sending Jesse a picture of it several months ago and thought, have you seen this? You know, we even have new businesses that's opening up, and I drove by one the other day, said vape and bake. You know, we know what the bake references to, you know, that's a marijuana reference as well. So vape and bake, and you know, what is our culture looking like? So I'll stand on your soapbox over here beside you, because this is definitely an issue that as coalitions that we're going to have to take a stand across the entire state. And you know, I was at that festival and I saw some of that. But you know, I didn't get all the pictures. I went over there at that tent, but I have a 5-year-old granddaughter, and the bracelets would have been the first thing that she would have been going to if she had seen it, sitting right there beside that pot. You know, so I certainly agree that for our children and for the sake of our community, and maybe that's something that we can develop a plan around, but it's marketing, it's branding. They're doing a great job of it, doing an outstanding job of, you know, the totally fried, you know, I'm like Elijah, I've never had a fried nacho, but, well, I guess you deep fry them, but, you know, I don't know, not in that sense. And then with the addictive powder, you know, again, it just starts changing. You think about the influence these commercials and advertising have on people. Just yesterday, saw my granddaughter, she fell back in the pool, you know, just like that. And it immediately come to me, the Nestea plunge. Okay, so some of y'all remember that. And that's, how many years ago has that been? You know, my husband immediately got it. I got it. You know, the other grandmother got it. And I'm like, that's been years since we heard that. But did it go away? No, it's still embedded. So marketing and branding of items and things stays with you forever. And the more that we continue to see this in our culture and our community, that easily it is going to be, especially with a lot of laws and trying to lobby for marijuana legalization. And just, you know, we've known forever, Dustin, you probably can yell at this, and Meredith as well, about kratom and the use of kratom and what, you know, that's an alternative to opioid, you know, and there is, and that's not the only thing that's out there. And I just mentioned to Melanie a while ago for me to make sure that I get to you all the PowerPoint with the overdoses from the Poison Control Center and the state of Tennessee on these edibles and where we are in the state of Tennessee, as well as the peeling off of those labels that y'all saw on there and the testing of those products for some as much as 99.9% THC. And these children are overdosing on them, as well as animals. Ask your veterinarians how many they've seen come in. That's why it says on there it's not for animals. Ask the veterinarians how many animals that have come in that use these CBD products or THC where they've had overdoses on animals. So anyway, maybe that can go along with developing a plan of action.
Right.
I'm hoping that's what you're going with.
I'm hoping that the next time you're walking down the boulevard and you see all these things, that it'll raise that awareness, because we see it without seeing it, okay? And it'll start to get on your nerves. And then you'll start talking about it. Because the more we talk about it, now we can bring it to someone else and get on their nerves. And that's how this starts. There are 5 vape shops within a mile, like probably 3/4 of a mile, between Deckard and Walmart, okay? With these big signs that have that on there. There are ordinances for other businesses that you can have only so many. There are ordinances on other types of signs that can be displayed. So at what point are we going to stand up and say, we don't want that culture here? And we start talking to the powers that be to do something on that. It's possible. That is the power that we have at the local level. But it's going to take more voices than mine. I need more people to join me on my soapbox. Trust me, there's plenty of room.
One thing we did was, like Sudafed in Franklin County, we have an ordinance, so we can't sell it at the pharmacy. I can sell you another decongestant, but I can't sell you Sudafed. So we, years ago, on this committee, we talked about, doing an ordinance, maybe that they can sell it or something like that, and maybe that's where we need to start.
I love it.
Well, it's not just on the boulevard.
No.
It's happening out in my community that I'm having trouble with.
Some of the stuff we purchased was in your community.
What's that?
Some of the stuff we purchased was
Yeah.
in your community.
Yes, yeah. I want to say this, I hope I don't offend anybody, but it's the foreigners that's coming in that's buying these stores out in the different communities that's causing this. And half the time, if I go in one of them, a couple of men will be talking all this foreign language back and forth. They may be cussing me, I don't know, I don't care. They don't vote for me anyway. But, you know, it's really bothering me because it's in my community, 2 stores. And people are calling me and I don't know what I can do about it, you know. I talk to law enforcement, we need laws, that's true.
And the laws take time.
Yeah.
And these businesses, and I don't mean our local convenience store owners, I mean the manufacturers of Cannabuds or Cannaburst, okay? They change one little thing in their packaging or in how they make it, and they're finding that loophole. So we've got to get some really good lawyers to really think about how can we close that gap, because the laws are lagging because of the time it takes to create a law versus what can happen in our community. And I think, you know, like statewide control on that would be great, but we have the power to do something local. We have the power. This is our community. One of the things that we did with Kiwanis in the past was create a vendor agreement. And in that agreement, they couldn't sell things like this. So, you know, that's probably something we're going to bring up again, and hopefully we can revisit. But it's not, like I said, it's not just that one carnival. It's every vendor that sets up anywhere. You know,
Maybe it'd be a county-wide law.
that'd be
Yeah,
good.
something countywide.
That's right.
And then not only could it be not selling of the merchandise, but also through the branding or promotion of anything that's eluding, like, you know, the addictive white powder. You know, that doesn't need to be out there. You know, any of that kind of stuff. You know, putting that out there, anything that alludes to substance use. I mean, obviously, you know, our community has a problem with drug overdose, but, you know, here we're starting from this age forward, just trying to embed it within them. Embed it within them, then it's okay. So definitely, I think you've got a great point. I would recommend looking for a lawyer that would be willing to work with a lawyer that would be willing to work with the coalition and government officials, like county officials, working on it with the coalition to sit down and say, you know, we need some rules and guidelines around this for our community, as well as working with your law enforcement and getting some folks out to do some testing of those products that you all purchase. That's going to make your impact. And there's availability for someone to come in and do the testing of your products.
Kind of need that to happen before Thursday.
This Thursday?
Okay.
We'll see if we can find somebody to make it happen for Thursday. But yes, there is availability for some testing to come in and test that, because there has been a lot of problems around distant overdosing with youth in the community.
And there's people coming into stores in my area that's not from my area.
Oh, yeah.
I've never seen them before. And I know about everybody that lives in my area. And they have out-of-state license even on their vehicles. I've watched this.
So, okay, I can say what's happened with Zaza, and Zaza is teraneptine.
Zaza Red.
Teraneptine. And I forget if it hits the same receptors, I think, as opioids. And I think, I might be wrong, it's been a minute since I've read that, I have a lot in my head. But if you take too much of it, it can come, do you know, can you speak intelligently about it?
So not too much information, but, you know, where I was working prior, we were having patients come in who were physically detoxing off of it. So, you know, they would taper them the best that they could with medications. And from what I heard also, it does, you know, bind the opiate receptor, but it is a real issue and people
I
are
had-
abusing it.
I had a phone call, I want to say it was January, last January or this January, I forget. But a gentleman called because he was really upset. He had a son in his 20s that had, you know, taken too much of it. And that's how it got on my radar. And so I started looking into it. And so, yeah, it's been a year. And his son was really, really sick and overdosed off it. He, you know, it wasn't a fatal overdose, but he got real sick from it. And he goes, I can't believe this stuff is being sold. And Alabama made it illegal to sell. And when that happened, until that happened, we didn't see a lot of it here. But as soon as that happened, it came into our stores. And so now it's here. Now the laws have changed, and I don't know if it goes into effect July or January, but there is a law that's going to make that illegal to sell here as well. So that did pass. I just don't remember what start date that law is.
Now, Zaza, is that through a vape or a gummy?
No,
or
it's a
is it
pill.
dietary supplement, the way they label it.
Yeah, Zaza, like that brand is in a black bottle with capsules. And you're supposed to take like half of one or something in that you're serving, but what, you know, there's like 15 in a bottle and people are taking all of them at one time. So.
It's the same issue with the kratom as well. I personally know people who are addicted to it and they cannot stop, so.
Comment. As far as all the temporary signs up and down the boulevard, Pat Sanders, you don't have to go to all this trouble. You just go down to Pat Sanders and code enforcement, tell them they require a permit, and he doesn't issue the permit because of content. It's just that simple.
Huh.
And there won't be any more signs, you don't have to worry about it.
Do they get a citation for the signs that don't have permanent?
Absolutely.
Yeah. Where are we now? Enforcer. Gosh, are we over time? I'm sorry, guys.
We are way over time. So announcements, I'll go quickly. Zumbas Tuesdays and Thursdays. Life Choices Baby Bottle Campaign just ended. Give a kid a chance. We've already talked about that. Make sure you visit the Franklin County Library for events that's happening there. Again, town hall meeting this Thursday, June the 23rd.
Oh, if you want to set up there, we have the whole entrance way. So if your organization wants to set up a table, just get with me and let's just set it up. And let's get services available to everyone in Franklin County.
Again, thank you so much for your time, attendance, and ongoing support for the Franklin County Health Council and the coalition. Look forward to seeing everyone here July the 18th at 12 p.m. Thank you.
All right, thanks.